Hi, you guys. This is Cedric Porter. I'm a family physician here. Been here now 34 years. I've enjoyed a lot of the time working with folks, but I can tell you that one of the things I haven't enjoyed is treating patients with COVID. Um, there are a lot of things that people have said about COVID, and I would just like to address a few. I'd like to start with encouraging everybody, please get your vaccines. Please, as soon as it's possible, have your children vaccinated. And please, wear your mask when you're out in public in closed areas such as stores, department stores, grocery stores, anywhere where it's enclosed, wear your mask. There are too many people in Emmanuel County who have not been vaccinated. And a lot of folks have a lot of different reasons for not vaccinated. One of them that I hear is people say, well, it's new and it happened too fast. But let me tell you a few things. I did some research and I was thinking about the vaccinations in this country. When you look back, the measles, mumps, and rubella vaccine was developed in 1971. And at the time, it was new and different. It was a live virus. People got the shot, and all of a sudden, people weren't getting German measles and regular measles. And now, unless people miss their shots, nobody gets measles anymore. Next was the oral polio vaccine. When I was a kid, I used to line up and get sugar cubes that had a nice, tasty substance on them. It turned out it was the polio virus. Everybody got sugar cubes back then. And later on, they actually switched the sugar cubes to a shot. And now, if everybody gets their polio vaccines, nobody has polio anymore. Now, it was a new thing to go from sugar cubes to a shot, but it turned out it was a very good thing because a few people were getting actual polio from taking the sugar cubes because it was a live virus. Now we use a killed vaccine. It's a killed virus. Nobody gets polio, and nobody has the disease anymore if they got their injections. When I first got here in 1987, I used to treat children all the time with meningitis. There was a certain type called H-flu meningitis. Now everybody gets an HIV or HIV vaccine as a newborn. And guess what? We don't see any H-flu meningitis anymore. Nobody has disabilities, brain damage, and hearing loss from H-flu anymore, as long as they get their shots. That was new, and that occurred back in 1980. But now it's a routine thing, and that meningitis is gone. Unless you come from a country that didn't get the shots, people don't get H-flu meningitis anymore. New is not bad. New can be very, very good. And sometimes we need to accept that and acknowledge that new technology comes along. I'll give you another example. HPV vaccines. They started in 2006. This is the first vaccine that prevents cervical cancer in women. No women who get the HPV vaccine can get cervical cancer anymore, except in very rare cases. We now know that human papillomavirus causes that, and this vaccine stops that. Women also don't have to worry about warts, and men don't worry about warts anymore either. Now that we give the vaccine in middle school, we've done a huge service to our children to keep them from having a lifetime of illness. Last but not least is the COVID vaccine. People say it's new. Yes, it is. Like all these other vaccines, the way they were developed was new at the time. And guess what? They changed history. We've gotten rid of measles. We've gotten rid of smallpox. We're reducing cervical cancer and warts. And we've gotten rid of so many different things, polio. Now we're going to get rid of COVID if people get the shots. You might say, well, people still get COVID. Well, guess what? If you survey the hospitals, 98 to 99% of the people in the hospital have not had the shots or only had one shot. It doesn't count if you get one. You have to get both shots in order to be protected. Now, when people get this shot, their chances for getting the disease are hugely decreased. They are protected. Now, if they get COVID, if they've had both shots, they almost always have a very mild and short-lived infection. If you get COVID and you haven't had your shots, I get to treat those folks all the time now. And I'm tired of seeing people on ventilators. I'm tired of seeing people die. I'm tired of people being sick and saying to me, I'm sorry, I wish I'd have done it earlier. I don't want to hear about anybody else being sorry about wishing they did it sooner. Just go ahead and get your shots, please. Take care of your children, take care of each other, and wear your mask. Thanks.